you will, of the assessment for Tracy. Also just generally speaking, learning how to use a goniometer. And I don't know if any of you guys have ever used one of these before. This is the little one. I think I mentioned to you previously that these are the small ones are pretty flimsy. And so when they get like this, it's time for a new one, because you want it to be able to, this one works going upward, but not down. You want it to be able to hold itself in position so you can take a measurement. And you can do it with the two arms and hands that you have versus needing another set, which sometimes you can feel like you need to be an octopus to do this. But you can order this on Amazon, and this is the 6-inch. And then the 12-inch one is the one that I like to use in person. It just works much better. It's bigger, it's easier to read. But I'm using a little MacBook Pro, and this 6-inch one is perfect. I can literally hold it right up to the screen. So hard to, I've now been doing this for 3 years virtually. It's, the COVID blur, but it's been really awesome. I was just telling somebody this yesterday that, obviously COVID has been horrible for pretty much everybody, but there were some pros, and one of which is that we all figured out how to use Zoom. And that kind of closed the gap around the world, friends, family, but also for business, because now there's not really anybody who doesn't know how to do Zoom or FaceTime or WhatsApp or whatever. And that means that you're not limited to clients that are in your geographical area. If you can coordinate with somebody and figure out the times and everything, the world truly is your oyster. Therefore, learning how to do these online assessments is invaluable. And, there's going to be a good number of cancer patients who are actually going through treatment, who are immunocompromised, and some still concerned about getting COVID. I know it's a big issue with my mom. So this is going to be a great alternative to doing this in person. So let's just go through the anatomy a little bit of a goniometer. Probably easier for you to actually look at the big guy on the PowerPoint. But we've got 3 parts. We've got the axis of rotation, which is right in the center, and then you've got a moving arm, which is like hand on the clock, and the moving arm should always be on the outside. In other words, if you have it on the inside, you're going to be reading it backwards, and you'll very quickly realize that you've got it backwards because you can't read the numbers. It's going to happens to everybody. If you've not ever used one of these, it's a bit confusing at first, but this is not only fantastic, when it comes to cancer, but anybody who's had shoulder surgery, shoulder injury, and an athlete, you're trying to improve athletic performance, they're a basketball player, they're a tennis player, golfer, whatever, and you've got to improve range of motion. First, you have to identify what plane of motion they're limited in, and then you can choose the appropriate exercises along with that. So we got the axis of rotation, the movement arm, and then lastly is the stationary arm, and that is the one that's actually attached to the circle. Now, if you'll take a look at the picture, which is basically a replica of this, but you've got 3 sets of numbers. Now on my little guy, the 2 outer sets are in red. Each brand does it a little differently, but we want to focus on the numbers in the middle, which are going to be 0 to 180 degrees, because when we're going from here up to here, that is, I got my chair in the way, that's 180 degrees. Now, in your book, you will have pictures and descriptions of how to use this for lower extremity as well. Very unusual for me to do that. I'm more likely to do that after somebody's recovering from an ACL surgery, to measure and see if there's an improvement in leg extension or flexion, or whatever it is we're trying to monitor. So it's really an invaluable tool, typically used by physical therapists. We are not, for those of you who are not physical therapists, we are not trying to replace physical therapists. This is, it's kind of like a common language that we can speak. So if somebody is going to a physical therapist, or, you want to share things with the doctor, we can now speak in this same language, which will be goniometric measurements. These pictures that I'm going to share with you are exactly the same as in your book. These are out of module 3. So don't fret. This is exactly what it's going to look like in your book. And with each measurement, you're going to see a stationary arm in line with the body. So when we look at this picture with Elena lying here, she's on a massage table, but this could be the floor. This could be, it might be standing up. It might be sitting down. You want to make sure though to differentiate. Somebody recently, a couple of days ago, posted in the Facebook group asking where they could find the assessment form. And I had mentioned that it's at the top of the Facebook group. I believe there's a link that says forms, but it's also after module 4 in your Teachable. And it's great because you can just print it off and you've got everything in there. You know, you've got flexion, extension, abduction, internal, external, left, right. You've got your postural assessment. And, you know, it's just basically checking things off, which makes it a lot easier. You know, Scribble Scrabble is fine too, if that works for you. When I didn't have time to print one off, I'll just, you know, jot it down on paper and that's fine. So we identify, you know, where does the stationary arm go, and axis of rotation tells us to set the shoulder joint. Well, in my very scientific terms, I call this the squishy spot. And if you think about where the upper arm, the humerus, goes into the shoulder girdle, there's this space to allow for movement, right? Well, if you lift your arm out to the side a little, you can feel that indentation, or better known as the squishy spot. So that's what I use as my axis of rotation. Now, as you'll see Tracy and everybody else, when we're doing this, I'm going to tell you, okay, I want you to, you know, lift your arm out, find this spot. We have to give our clients cues, much like we did with the postural assessment. Alternatively, just visually, you know, go from the, you know, chromium, or pick any landmark and go about 2 inches down, and that's going to be your axis of rotation. When you're in person, if you have this pushed up against the person, it's going to screw up the measurement, because as their arm moves, it's going to throw you off a little. So you really want to hold it away from them a little bit. And I always hold the bottom end of the goniometer, and then I can move with my other hand. If my hand is down here, then I try and move it, and my thumb is interfering with it. So it just takes some practice to get used to it. So we've got this set up at the axis of rotation. Stationary arm is always going to stay parallel. If it moves, we just move it back, no big deal. And then the movement arm will follow along with the arm. Now, if her arm is completely flush with the floor or the bench or the table, then it's pretty safe to assume it's 180 degrees. I don't even need a goniometer. But, you know, if it's somewhere in between, then we can be precise about it. The other thing that's really important to convey to your clients, especially if you're doing this virtually, because if you're there in person, you can use your hand to kind of, you know, adjust their arm, is that when they're going through a plane of motion, that there's no shifting. It's as if there's a pane of glass right here. So when we're doing flexion, it's true flexion, because as soon as they do that, now we're into abduction. That is not going to give you a true and accurate measurement. So really important to do it consistently, the same way every single time, and make sure to jot down, did you do this supine? Did you do it upright? Some people won't be able to get down on their back. Certain things like virtually, I can't do abduction lying down because I need to have a camera above the person. So different things like that, you know, you're just going to have to be innovative. Now, these 2 bullet points are primarily for physical therapists or occupational therapists. Or if you remember, I've always said, any of us who are on the fitness end of things, we are taking a hands-off approach other than assisted stretching. We're not massaging. We're not doing anything like, you know, deep tissue massage, myofascial release. And so what these things are more geared towards physical therapists, and they understand what an end range of motion is and the way it feels. But what I want you guys to do is to use your eyes. And when Tracy, for example, when we're taking these measurements, we're going to look and see, you know, when you start off, what does the curve of your spine look like? Where is your scapula? And then look for excessive motion. You know, we don't want to see your back start to arch. People do that, you know, as they're trying to reach further. Basically, we don't want people to cheat. So we keep them in the plane of motion and then watch for excessive range of motion. All right. The norm is 150 to 180. So that's something like from here all the way up. different people, it varies. You know, one person's norm, even on an unaffected arm, might be 150 degrees. So what we use as a rule of thumb is that your client must have 90% or better of the lower number. So in this particular case, it would be 135 degrees before you add a load. And what do I mean by a load? I mean a weight, a band, even an isometric contraction, holding a yoga pose, holding a warrior one. If somebody's arm is like this and they're holding that for 30 seconds, the muscles are still stabilizing. They're still, they're still not the same as, lifting heavy weights or whatever, but they're still going to get stronger in that position. And that's going to make it that much more difficult to regain or to acquire full range of motion. So keep that in mind. 90% or better, and that's only in that specific plane. So I might be limited in flexion, but I might not be limited in extension, and therefore I could start doing, strength training exercises that are in that particular plane of motion. Abduction, and by the way, all of these are done, you can't see, but her knees are bent. You always want, if your client's head is tilted back, which many people, if they have forward head when they lie down, they're going to be tilted back like that. So we want to prop them up on a little pillow or folded up blanket or something. Knees are always bent, which will help to minimize arching of the back and any excessive movement. And when your client, you need to let them know to always be looking up at the ceiling. So we want their nose to the ceiling, because when they're watching you, that's going to affect the range of motion, and everybody wants to see what's going on. Axis of rotation of this one is actually pretty easy. It's like literally right at the armpit, so you can just kind of eyeball it. And the stationary arm is in line with the body, but notice this time it's not along the side of the body, it's on top of the body, but in a straight line coming straight down. And then the movement arm is going to follow the arm into abduction. Now, when this is done on a floor or on a bench, we want to make sure that the upper arm is always in contact with either the bench or the floor. So I don't really care what's happening from the elbow down, but this part of the arm, if it comes up, notice how I'm shifting. See, I'm not in true abduction anymore because I'm moving my shoulder so that I can go further. So if you use that methodology, that's going to give you a more accurate measurement. The other thing with abduction is you'll see people leaning to the side. So you just have to be really aware of these little alterations. Once again, the bullet points are more geared towards physical therapists, but just looking for any excessive movement, which I pretty much just described to you. Extension. If you look in any scholastic book on goniometric measurements, you're going to see them lying prone and lifting up behind them. Yeah, try putting somebody who just had a mastectomy or breast reconstruction in that position, for that matter, even if somebody's had lung surgery, radiation. Generally speaking, it's not the most comfortable position. So we've come up with this alternative, which is side lying. It's going to be really important from the cervical spine all the way down to the coccyx or the tailbone, that your client is in a straight line. Once again, you can see how I've got her head elevated. It's a little too high actually, but it should be pretty neutral. And then she's kind of in a fetal position. So in this particular case, when somebody's going into extension, they're likely to elevate their trapezius and jut their head forward when they do this. So that's what we're looking for. The axis of rotation and the stationary arm are exactly the same as flexion. So it's the squishy spot. And then, we're either moving forward or backward. And when we're taking the measurement, we're typically going to the elbow, but you want to do it in the middle. Okay, because if we go laterally or medially, it could actually alter the measurement by about 10 degrees. So when we do it, just go straight up the middle of their arm. Oops, didn't mean to do that. Okay. Now, external and internal rotation. The starting position is exactly the same. So we're either doing this or we're doing that. And the stationary arm and the movement arm both start potentially, in the same position, which is perpendicular to the body or the table. And then you just decide, are you moving backwards or are you moving forward? Now, when you're doing it on a bench like this, you can actually line up the axis of rotation exactly at the elbow. But what happens if you're on the floor? And then you can't get the axis of rotation there because you can't go through the floor. Virtually you can, because you're doing it on the computer screen, but in person, you're going to have the bottom of the goniometer touching the floor. So the axis of rotation is actually going to be about an inch above the elbow. So you just want to make sure that you notate that when taking the measurements, because whether it's you or somebody else who's taking them at a later date, if you don't do it exactly the same way, you're not going to get accurate measurements. And the goal here is to come up with a baseline for each individual. Now, these norms, really it's just a starting point, because the only thing I really care about, for example, Tracy, is if you have limited range of motion in a particular plane today, all I care about is helping you to increase that range of motion. I don't care how you match up to the rest of the population. It's just looking for improvement, but this gives us some place to start. So with external rotation, it's 70 to 90 degrees. If your client goes all the way back and their arm is flush against the table, similar to where Elena is in this picture, she's not quite 90, but she's pretty darn close. If your stationary arm happens to move, so it's no longer pointing straight up, it's an easy fix, right? You just make it perpendicular again and then realign the movement arm so that you can get that measurement. And then last but not least is internal rotation. This may be one of the more difficult ones to do. People tend to cheat a lot. This is not entirely passive, because we are moving our arm to go through the range of motion. However, in internal rotation, we want the arm to just kind of drop as opposed to engaging the shoulder. So what we're looking for is when you see, even though I'm wearing all black here, you can see the movement in my shoulder excessively. And when you're in person, or I can say, Tracy, if I were there, I would ask if I could place my fingers right beneath your clavicle, but otherwise I'm having you do that. And when you're doing this, as soon as you feel this muscle tighten underneath your fingertips, that's it. Because at that point, you're activating the muscle to acquire more range of motion. Another thing, people tend to end up with their arm like this or like this. We want to make sure it stays at 90 degrees at the elbow joint consistently. So these are just some different things that you can expect. I use the word cheat. It's just a word. I'm not trying to insinuate that somebody's doing something wrong. It's our, without even thinking about it, we try and outdo ourselves. So you don't necessarily have to use that word with your clients, but just be aware of all these little idiosyncrasies. So I'm going to stop the screen share. Let me know if any of you guys have any questions. For extension, the norm was 40 to 60. I just popped out of that one. But remember, you have this in your handbook. Exactly. And then Tracy, I'm going to have you unmute. I'm going to make you the superstar here. All right. Just like with the posture. Oh, I like that picture. Looks kind of like Santorini, but not really, but it makes me want to go there. Looking at her picture on the wall. We get what we get with our clients. Can't control the lighting, I can't give them a massage table. So I like to have the discussion ahead of time and kind of talk about how we're going to do this. I see we're looking at a sofa here. I'm not sure if the screen froze or if Tracy is still there. Tracy, if you are there, yeah, there she is. I was like, where'd you go? Okay, and then if you can unmute at your convenience, because I can't see you or can't hear you.
Do you want me to go on the floor?
Well, so here, let's start from scratch. So do you have a chair that doesn't have arms that'll be in your way?
Yep.
All right, so let's start with that. And then, yes, we will go on to the floor. But as I said, there are certain measurements that I can't do virtually. I would need to have somebody, standing above you with a camera to do abduction. So go ahead and have a seat. Maybe, are we able to lower actually, it's not really bad, but if you could lower it a smidge, that'd be great. If not, no big deal. Doesn't really matter that I can't see, her hand at the beginning of the motion. I really just need to see this part of her arm as she's moving. Now, in the absence of having my formal, printout of the assessment, I'm going to just make a little chart here, left and right, and then just number of different rows for flexion, extension, abduction, internal rotation, external rotation. Okay, so let's begin with your right arm. And when we're doing abduction, your palm will be facing me. So when you're hanging down, your arm will be like that. Now, I'm only worried, we're just going to do the right arm. The axis of rotation is right at the armpit. I don't need to exactly see your armpit. I pretty much tell where it's at. And I'm just putting
Take this shirt off.
Oh, if you're okay with that, sure. You have the cutest skirts and all. Okay, yeah, that makes it much easier. So I could just put that axis of rotation literally up to the computer screen. Now I have to rely on you, Tracy, to imagine either that you have a wall behind you that you're keeping your arm against, or imagine me pushing your arm back. Now you can always use the wall if you have one handy. Not everybody does. So let's see. I don't know if I will, because of the angle of your wall, I don't know if I can get a totally accurate measurement. Let's try it. But you're sort of angled, and it's not the end of the world. So don't worry. Oh, look at you. All right, there we go. You're just making this too easy for me. Okay. Now you technically still don't have a wall behind you, so it's really not going to matter too much. So palm facing me, just imagine the wall behind you. Imagine me kind of doing this with your arm so that it's not coming forward. And then I want you to do this as slowly as you can. The reason that it needs to be slow is because if I see you starting to, do things like this, I'm going to be like, wait, back up and have you go back a little bit and take the measurement there. Okay.
Okay.
Whenever you're ready, let's start with the right arm, palm facing me. And then just slowly start to move. So your thumb's going to be pointing up to the ceiling. Think about doing a jumping jack.
Okay.
Okay, nice and slow. Keep the shoulder back. Remember, you've got this imaginary wall behind you. And as we're looking at her, we want to make sure that, everything stays linear. She doesn't start to tilt. Okay. And if you feel any, resistance, that's also usually an indication that you're there. Now, see your upper arm keeps moving inward, but really you're stuck. I'm sorry, your lower arm is moving in, but that's where you're at. You're starting to, do you see what's going on with your head, Tracy? You see how you're starting to tilt to the side? Okay, so I'm going to take the measurement right there. Hold on, bring it back up a little bit. So I'm taking my movement arm and I'm going straight up to that elbow joint. Okay, you can relax your arm. We want to get this done as quickly as possible for our client's sake. And I don't know if you guys can really see this, but see where that divides right there. That is about 141 degrees. So that is her right side, 141. Now remember, the norm is 150 to 180. She has to have at least 135 in order to do strength training or any type of resistance, and we're there. Now, I guess, Tracy, you might have raised your own hand by accident, so we won't worry about that. Okay, so now we've got to do your other arm, but you can just move your chair over, yeah. And actually, you could use the wall on that one if you want. And just kind of, keep your arm along the wall. So keep it back. There you go. And just be aware not to tilt your body, not to let your head tilt. Okay, and as soon as you feel your arm, your upper arm, so not your forearm, but if your upper arm is kind of coming up and off the wall, then that's too much. Okay, so right about there. All right, I'm going to take that measurement there, and I'm getting 130 degrees on that one. And let me just look at, go ahead and relax your one real quick. Okay. So I am inclined to think that we're at an odd angle here because it's the right side that you had everything done on.
Yeah.
So I do think that you're kind of like this again. Let's ignore this wall behind you, just kind of, yeah, come forward or whatever. And you're still turned a little bit, your left side is more forward than your right. And these little things are important because otherwise it's going to mess up your measurement. So let's go ahead and try that again on your left arm, if you would. Just imagine the wall behind you. Now, the second time, of course, naturally is going to be better anyway because you're loosened up a bit. Okay, hold on. I didn't get the measurement yet. There, keep going. Okay. And
There.
hold on. See, even I screw this up occasionally here. Okay. All right. So that one is I'm getting about 150 degrees on the left. And like I said, if you keep doing it, it's going to keep getting better. Which is why something like active isolated stretching is so beneficial, because you repeat, you do a little extra, and you keep doing that. And it's not a permanent solution, but when you do it over and over and over again, it definitely makes a big difference. The next thing we're going to do is extension. So I'll need you to turn sideways, either direction. And so I'm looking exactly at your side. Perfect. Is your arm free to move past that chair, or is it in the way?
No, I'm good.
We're going backward. Now, as we look at you, and Tracy, you'll probably watch this recording later, your head naturally is in the forward position. So what we want to make sure is that it doesn't go any more forward as you do this particular measurement. So think about me pushing your arm towards your body. In other words, it can't come out away from you. You're simply going backward. If we or you notice your head going forward even more when you're doing this, then that's as far as the measurement goes, So for example, like if right now, let's say you're like this, and I'm just making this up, and I'm raising my arm and I start to do this more.
That's where it stops.
Yeah. Okay. So the axis of rotation is the same as it was for flexion. Well, my infamous squishy spot, or about 2 inches below the acromion. Okay, so yeah, you're right on the bone there. So we want to go down. All right, whenever you are ready. Okay, and keep your arm close to your body. If your chair is in the way, sit more on. Yeah, that's a good idea. Perfect. Perfect. Okay, whenever you're ready. All right, so back up a little because your head starts to go forward a bit. Okay, right about there. And let me get that measurement. And you are right at 40 degrees. And that is on the left side. Norm is 40 to 60. So perfect. All right. And whenever you're ready. And I'm literally holding this goniometer right up to the computer screen, taking this measurement. Okay, back up a little bit. Head's moving forward. There we go. Okay, try again a little bit more. All right, so we're at about 48 degrees on that side. Now, there's always room for error here, especially virtually. However, as long as we're consistent, that's the important thing, because I want to see an improvement. This is not a matter of life or death. This is not competitive. The only person we're competing with is ourselves. All right, next.
I just remembered this. In 2004, I had a left frozen shoulder.
Okay. What was that from? Just
to be honest, I think it was an act of God. I didn't have, no, it was because my mother, I was able to come home and be with my mother right before she died. So 2 weeks after she passed, I was back in Texas, and I woke up and I could move and everything.
Oh, weird.
So yeah, I don't really know, but I did in fact have a frozen shoulder.
Okay. All right. Well, that's good to know. We can stay sideways again. We're going to do flexion. So just like we just did with extension, axis of rotation is right in the center there. And again, making sure the head is not going forward. So go ahead. Imagine me pushing your arm inward, up, thumb up to the ceiling, Tracy. There you go. And go as far as you can. Also looking at the line of her back, making sure she's not arching it. And go as far as you can without pain or compensation. Okay. Say that's about it. So on the right side, I'm getting 145 degrees. And as I said, norm is 150 to 180. All right, ready when you are. Keep it in, don't let it go out to the side. There you go. Okay. Okay, back up a little bit. You're moving your head. Okay, right about there. So they're pretty much about the same, 145. Okay, now we are going to go down to the floor for external and internal rotation. And I could also do flexion on the floor.
So do you think this is a good angle or just right on the floor?
Well, if you want to lie on your coffee table, yeah, go ahead and lie on the floor. I think you'll be just
I don't know
fine.
about that coffee table thing.
Yeah, and it's not long enough. I don't think you'll be very comfortable anyway. Okay, so why don't you scooch down towards the direction of your feet? Yeah. All right, now can you move closer towards your coffee table? Because I need to see more of your arm. There you go. Good times, right? Okay. So I'm seeing if I can't adjust the screen. So I'm going to need your arm out to the side like this, but your elbow is on the floor. So yes, exactly. Now, yep, you got it. Perfect. Thank you. Wonderful. All right. So let's get it, just below shoulder height, but out so that it's, yep. Now arms straight up to the ceiling. Perfect. Let me move this because the pictures of us are in the way. Okay, drop your arm a little bit below shoulder height, not your hand, but your actual upper arm. Drop it down. There you go. Yeah, not quite that much, but just right about there. Now make sure your forearm is straight up and down. Okay. So the stationary arm, actually both are going to start off up and down with the axis of rotation just at her elbow. Now, if I were there, I'd be, on the floor, but because I'm on the computer, I can actually line the circle up at her elbow joint. So let's do internal rotation first. I'm gonna probably have you scooch down a little when we do external. Now, remember on this one, I want to make sure you're not cranking your shoulder forward. The angle of your arm needs to stay at 90 degrees. Palm has to face the floor. And you're, of course, going to be looking up the whole time you're doing this. But what I'm looking for is excessive movement in your shoulder. And I want you to be aware of that as well. Now, what you can do is you can take your fingers on your right hand. Oh, you can't see me. I keep forgetting because you're the spotlight. Put it right under your clavicle on your left side, right under your shoulder girdle. So
Right here?
hold on. Let me unspotlight you. Okay, can you see me right
Yeah.
here? So, if you contract your pec, you're going to feel that. And so when you're doing this, if this is contracting, you're going to feel it underneath your fingers. Okay. All right.
As soon as it starts to move.
Not as soon as it starts to move, but when you feel it really engaging, just think about letting your arm just do this, like without actually activating the muscle, if that makes sense.
All right.
Okay. So let's give it a shot whenever you're ready. Okay. Now what I can also look, and everybody who's watching, look at where her shoulder joint is in space, and look at the back of her arm. And when it starts, go ahead and push your hand toward the floor more, just for kicks and giggles. See how her shoulder starts to come up and the back of her arm comes up. We don't want that. So go ahead and back up. All right. And now let's do it again for real, slowly.
So right about there,
Yeah,
my
yeah, exactly. So now I'm taking that movement.
floor.
I'm taking the movement arm to the wrist, to the epiphyses of the wrist, and we're going right in the middle, just like we did in the other measurements. So I'm getting 35 degrees. Norm is 40 to 60, just like extension. And that is your left side. So 35 degrees. All right, now let's go ahead and go back to center. I think we're actually fine. We can go, even if I can't see your hand, it doesn't matter. Keep that 90-degree angle at your elbow joint, and then go ahead and rotate backwards. On this one, we're looking to see if there's any excessive movement. You can see she's got the little curve in her low back. We don't want to see any more than that. And don't let your arm go inward. Keep it at 90 degrees. I see your hand wanting to go in towards your head.
Probably, yeah, like right
Okay,
there.
that's it then.
I'm changing.
Okay, so push your forearm toward the camera a little bit more. You're going in towards your body. Yeah, there we go. All right, so I've got you at about 50 degrees, and that is on the left side. Okay, hang on a second. 50. All right, go ahead and relax. Now we got to flip you all the way around. We'll do the same thing. All right, now you know what to do with your arm. Okay, so bring it up just below shoulder height. Bring that, yes, perfect. All right, why don't we go ahead and do external first? It seems like your arm is inclined to go backwards, so go ahead back toward the floor. Okay, and again, it doesn't matter if your hand's touching the floor. I'm only measuring to the wrist. So I've got about 75 degrees on that one. Okay, so that is 75 external on the right. All right, now we're going to do internal. Again, make sure the arm is, hang on a second. Bring your upper arm up a little, no, there you go, perfect. Okay, and you've got it, be careful of letting that muscle activate too much. Keep that 90-degree angle at your elbow.
You're right there is where.
Yeah, and I can see it, you know, I can see you kind of resisting. All right, so we've got about 30 degrees there. Okay, so Tracy, why don't you go ahead and make yourself comfortable and sit up. I'm gonna unspotlight you. And or you can lay there if you're comfortable. So I just want to point out some things. So for starters, what I'm looking for is big differences between sides. And so with external rotation, I've got a significant difference here. 50 degrees on the left and 75 degrees on the right. And as she said, she had a frozen shoulder on her left, and then she had, you know, surgery, radiation, whatever on the right. So we've got issues on both shoulders. Now, we also had a bit of a difference on abduction, not as big as this guy, 9 degrees. And remember, that's not that difficult to be off by 5 degrees, just human error. So first thing, you know, I circled in orange, the ones that are significantly or semi-significantly different. Then the next thing I want to do is look and see if each of these meets that 90% or better. So we know that in flexion and abduction, which the norm is 150 to 180, she needs to have at least 90%, which is 135. And so you can see with flexion, I've got 45 on both sides. So we're like, all right, you know, if you want to do anything with resistance, whether it's a warrior 2, whether it's lateral raises, you know, jumping jacks are not with resistance, but I you know, can't imagine somebody lifting weights doing jumping jacks. So whatever it is, you're not limited in that plane of motion. Then also in abduction, norm 150 to 180. You measured out at let's see, I'm looking and I wrote down 150 on the left and 141. So 135 would be the minimum. So you're good on both abduction and flexion. The first one I was actually showing you, I'm like reading this backwards because I'm trying to look in the camera. So the first one was actually flexion. The next one is abduction, but in either of these cases, flexion, abduction, you don't have any limitations. Then we go on to extension is 40 to 60. You're at 40 and 48, no problem there. Internal rotation is also 40 to 60, so 36 degrees is minimum. So we're a little low on internal rotation, okay? So I'm gonna take a green highlighter here, and I'm gonna circle that. And then for external rotation, we need a minimum of 63 degrees. So, and hopefully this is going to make sense to you in a minute. All right, so the orange just shows the discrepancies between sides. The green ones that I highlighted are the ones that don't quite hit that 90%. So that means when we come back on Thursday, and we're going to take the postural assessment. We're going to take these goniometric measurements. We're going to start putting together your workout. That means before we consider any exercises for internal rotation on the left and the right side and external rotation on the left side, we're going to first do some range of motion exercises to get that range of motion a little bit improved before I load that plane of movement. Plane of motion. So it's really minimal, not bad at all. And you know, some of these things like the internal rotation is right on the edge. So quite frankly, we could write it off to human error and say you're pretty good. But what's the worst thing that happens? You go to module 3, you can see here, let me tell you the page that it's on. One moment, please. And you guys should start looking through, you know, module 3 just to familiarize yourself. And then this is how we're going to come up with our exercise program. You know, we've got a bunch of stretches at the back of the book, just manual stretching techniques. But on pages 69, 70, and 71, you're going to see some various exercises for improving range of motion. Now, these are not rocket science. You can come up with your own if you're a Pilates instructor, yoga, aquatics, whatever. But for example, if we want to work on internal rotation, I'm gonna go here and I've got a couple different options. This might be the most viable, where you have a dowel or a towel, and you can use, which will be great because then you can work on, you know, internal and external. So this arm's in external, but this arm's in internal, and then the one arm helps the other arm. So you're kind of doing your own active isolated stretching. And quite frankly, you're so close to having, you know, what we want with the range of motion that I bet you if you did that exercise for the next couple days and we took your measurements, you'd probably be where we want you to be. So what I'd like to leave you with before Thursday is ask you to review module 3. If you don't have the hard copy book, just look at the download. And we've got all of the postural assessment. We've got the squat test. We've got the goniometric measurements, as well as the exercises that you are currently doing. So what we're going to do is we're going to come up with an exercise program based on your risk factors. And I'm going to break it down one step at a time. We've got a 2-hour session on Thursday. And we might say, hey, yeah, what you're doing is great. Or we might say, let's tweak this a little bit. Let's get rid of that. Or maybe everything you're doing is perfect and we leave it alone. I know you guys in the background are doing your thing, so I'm not going to call you out. But if you have any questions, let me know. And Tracy, do you have any questions before we end today?
I don't think so.
Pretty cut and dry. And honestly, like the goniometric thing is just practice. So order yourself a goniometer. practice on somebody, but don't do it so much that you wreck their shoulders, because I'm pretty sure that was what destroyed my shoulders back in the day. Was I used to have people actually test out doing this in person, and I'd have 20 people, taking all of my measurements. I couldn't move my arm by the end of the day. Yeah.
I do have a question. So like, I'm not a certified personal trainer or anything like that. I've only done that health and human performance. So should I get some sort of personal trainer?
We have all different groups of people here. I mean, we've got group exercise, we've got Pilates, yoga, personal training, nurses, PTs, OTs. Some people are just going through the journey themselves and want to learn for themselves, and then others. So what I would say for anybody who does not have an actual certification or degree is, if that's something that you'd like to pursue, whether it be personal training or you want to be a Pilates instructor or a yoga instructor, any of those is going to be a great complement to this. And getting through this course will certainly set you up if you did not have experience previously, because you're going to have a lot more knowledge coming out of this to then go in and take one of those other courses. One of my, I would actually say my favorite certification I've done, ACSM, ACE, NASM, Cooper Institute. The NASM corrective exercise specialist is hands down my favorite, and it complements this so well. In fact, I reference a good amount of information as far as the assessments from NASM. So I would highly recommend that one to anybody. But I'm also an ACE certified personal trainer, another great certification. I mean, they're all good. It's just kind of what resonates with you. And I like the corrective exercise specialist, because that's really what we're doing, is corrective exercise.
Okay.
So if you're not familiar with the acronym, it's National Academy of Sports Medicine, NASM.
Yeah, NASM. I mean, that was a big, one of the ones, once I was coming out of that degree program, I was doing the holistic nutrition, and I was like, I can't add another one on right now, because I love to do them all.
Yeah, exactly.
I also want to do a stretching one, because I think that stretching is
absolutely. And I mean, you could do a whole not necessarily a certification. I'm sure there are. I mean, you can get a certification for anything, but also taking a course on active isolated stretching is fantastic. I mean, there's a lot of things that you can add to your arsenal, but rather than being a jack of all trades, master of none, pick something that you can be really good at. And the one thing that I will say is, thanks, Nick. Have a good one. The one here, I'm going to go ahead and stop recording. So for everybody else, we'll see you on Thursday. And thanks again, of course, to Tracy for being our model. I'm going to stop recording, and then we can stay on.